Dr. Kruger had a great idea. How can we make this easy and accessible for the patient that has a good flow, and they don't have to strain themselves by walking or having to use a wheelchair because they can't. So we had all of that in mind.
Well, that was one thing that we wanted to do, is to make the patient flow as easy for them as possible. It was one reason we kept it as a small unit. And the patients literally can go from the covered curbside into the waiting area, get them ready for the procedure, walk about 30 feet to the procedure room, have it done, and basically reverse that to be discharged. We have partnered with a group that manages 16 or 17 other surgery centers. They help us build this from the ground up, and so they've had the experience with the patient flow as well, and that has worked to our advantage.
What stands out to me is the staff. They're just very friendly, very fun to be around. It makes your day enjoyable. We all work very hard, so I think that it's really important to have a good surrounding, supporting cast so that you can get through your day, because sometimes the days are easy and sometimes they're not. The nice thing about Robin is that she does have a really great personality, so she's very easy to get along with, because let's face it, us physicians, we have all different kinds of personalities, and some are easy and some are not.
Every day I am out in the front office sometimes. I see the patients when they come in, try to get them comfortable, because they're usually apprehensive about any procedure or surgery that they're going to have.
Cornerstone is an outpatient surgery center, so there is no overnight stay here. Plastic surgery lends itself to outpatient surgeries because most people don't have much blood loss and aren't very sick. When I think about a place I want to go to work and take my patients, that's a big consideration for patients, and that's a big part of the process for them. So I need that place to be accessible to them. I need the staff to be friendly to them. I need it to be clean. I need it to be relatively private. I like it if it's not too busy. I don't think patients appreciate being run through a very, very busy place where they just feel like a number. And I need the staff to be competent, and that's one of the things I like about Cornerstone, because we have a small group of staff that I work with every time I come here. And since there's a limited number of people that I work with here, they all know how to do the cases.
We do all the procedures in the surgical center here in Cornerstone that we will be able to do in the hospital. It's a very personable staff. They get to know our patients. Their waiting time is minimal. Robin, she is a sweetheart. We're blessed to have her as part of the team. She takes ownership of it, and that's great. That's what we want.
My job is to try to keep everybody happy, keep the patients safe, keep the doctors happy, work with the staff as much as you can. That makes the whole facility run smoother.
When the staff feels like they belong and the surgeons feel happy with the staff, the patients can sense that we all work together as a team and we feel like we're a team, and that, I think, brings them into the situation with more comfort from the very beginning, and that's important. And it's true and it's real. I prefer to work in a place where it's fun to work and where the people are nice people and they do a good job and you have confidence in them, and that feeling is reciprocated. That's a nice feeling, and it works out much better when it's that way.
I mean, we've had patients just about every week that come in. Last week I had somebody come in a wheelchair. We did a procedure, we got them into physical therapy, and they needed a crutch to get out, but they were walking out of the building.
To be able to see a patient that has no quality of life, and through the things that we do in our office and here at the center, being able to restore, if not all, a good percentage of that back to the patient. So it's like giving back life to them and quality of life.